So there have been a lot of confusing messages on the virus, right? After more than 1,000 health officials banded together and they said that racism was more dangerous than the virus. In other words, you should go out there and protest. In New York, Mayor de Blasio sent out dramatically different messages before and after the death of George Floyd. And then the governor in New Jersey, who encouraged people to social distance, then joined the protesters, everybody standing shoulder to shoulder as they went through this. Governor Murphy sort of got into this himself when he joined the people in the streets over the course of this weekend. So is it a fair question in New York, New Jersey particularly, right? There's still churches closed, businesses closed. They're wondering, why should they be shut down? Why can you not have a funeral or a wedding if you can have a protest? And these large gatherings are allowed. So joining me now on this and some other big developments in the virus tonight is Dr. Scott Atlas, senior fellow at Stanford University's Hoover Institution. Dr. Atlas, thank you very much for being here. So, what's your reaction to that? Why are we being encouraged to go to these mass gatherings and protests, but yet you've still got businesses in lockdown and schools and churches in lockdown?
Well, yeah, thanks for having me, Martha. I think the big question is really why these businesses and schools are closed to begin with. Really, there is an obvious denial of the science and of the data. I mean, we know that the WHO yesterday said, quote, it's very rare, unquote, to have asymptomatic people transmit. We know there's really no risk to young people. 99.9% of deaths are to people under 24, which means the universities and the schools should open. There's this bizarre fixation on stopping cases when cases are being defined by a positive test. The only thing that matters are the cases that are serious, that require hospitalizations or death. And when you look all over the world, countries that have opened or partially opened, like Switzerland, the Netherlands, Denmark, Austria, they are not experiencing a higher number of hospitalizations or deaths. And this is weeks out already. They are accelerating their openings. And the same thing goes for the states here. When you look, as I did today, at Florida, Texas, Georgia, they may have more cases, but that doesn't matter if it's only people that are not going to have a significant problem with the infection. When we open up, we're going to have more infections if there's a contagious disease present. When we test more, we're going to have more cases. That's not the issue. The issue is to make sure we don't have this people who are going to get super sick or die get infected. That's the point. That's the denial of the science going on here with these closures.
It's a great point. I mean, we've been sort of talking about this a lot in terms of these little bits and pieces from different studies, which basically were all pointing in the direction of if you are symptomatic, you are likely to spread this disease. If you're within a certain range from someone and you cough or sneeze on them, that is the most likely transmission for this. And, we've had so many people terrified. I was in the beginning, too, about asymptomatic spread. Why was that sold so strongly when obviously they didn't know in the beginning whether or not it was true?
Well, I think what happens is we have a tremendous amount of fear. And again, like I've said before, I'm empathetic to the fear. And the leadership of the states and the, others really all over the world sort of let that fear impact their decision making. I mean, there's all kinds of things. Nobody questions, by the way, why the WHO says 3 feet, yet the United States says 6 feet. The science behind the 6 feet is completely sloppy and what I would call lame. Nobody gives, by the way, publicity to the WHO's recommendation, quote, they do not recommend masks for the general public, unquote. Even in their updated note, if you bother to read their whole technical note, they say that. And they're talking about the only time you wear a mask is if you are at risk, high risk group in an area of widespread transmission of the disease, and when you cannot be 3 feet away from someone. There's a tremendous amount of fear, and there's a lot of smart people using what I would call sloppy thinking here.
Food for thought. Dr. Atlas, thank you very much. Good to see you again tonight.
Thanks.